Today we're diving into an important topic: who gets skin cancer? Many people think that skin cancer is only a concern for certain groups, but that is not the case. Skin cancer doesn't discriminate by age, gender, or even skin tone. There are certain factors that influence risk, including skin types, genetics, environmental factors, and we will discuss them today so you can better understand them, and hopefully it helps you to know how to protect yourself and those you care about. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. To understand who is most at risk for skin cancer, we need first to talk about the Fitzpatrick skin type scale, which categorizes skin types from 1 to 6 based on how your skin reacts to sun exposure. Type 1. We have someone who is very fair-skinned, often with freckles, red and blonde hair, and light-colored eyes. These individuals burn almost immediately in the sun and rarely, if ever, tan. Then we have type 2, fair skin that also burns easily but may tan lightly after repeated exposure. Next, we have type 3, beige or light olive skin that tans more easily but can still burn. Type 4, medium or olive tone skin that rarely burns and tans well. Type 5, brown skin that burns minimally and tans deeply. Finally, we have type 6, deeply pigmented skin that almost never burns. And here's the catch. While darker skin types 5 and 6 have more melanin that is protective because it acts as a natural barrier to UV rays, these people not immune to skin cancer. In fact, when skin cancer occurs in individuals with darker skin, it is often diagnosed at later stages because it can develop in areas not traditionally exposed to the sun, such as palms, soles, and under the nails. And another reason is because everybody thinks that the people with darker skin are immune to skin cancer, so there is a low suspicion for cancer. So the key takeaway is that your skin type affects your level of risk, but no one gets a free pass. Skin cancer can happen to anyone, and prevention is crucial for all skin types, for all of us. Next, let's look at the role of genetics. Genetics play a significant role in your risk of developing skin cancer. And if you have a family history of skin cancer, especially melanoma, then of course your risk is automatically higher. Certain genetic factors are especially important. I'll just look at two. There is MC1R gene. This gene is associated with fair skin, red hair, and heightened sensitivity to UV radiation. People with this gene mutation are more prone to burning and are at a higher risk of melanoma. Of course, it doesn't mean that every redhead has that gene. Another important gene that I'd like to mention is CDKN2A gene. This mutation is linked to familial melanoma. It increases the likelihood of developing melanoma, often at a younger age. Prevention of cancer in these individuals includes not only the sunscreen and not only seeking shade and wearing some protective clothing, but also frequent skin checks. And we'll talk about that. The next key factors are environmental and lifestyle factors. But before we move on, if you're enjoying this video so far, please don't forget to like, share, and subscribe so you don't miss my other videos and upcoming videos on a variety of medical topics, including skin health, functional medicine, latest medical research, and so on. So back to environmental and lifestyle factors. Your environment and daily habits significantly influence your risk for skin cancer. And here are some of them. So UV radiation. The sun's UV rays are the primary culprit behind most skin cancers. And there are UVB and UVA rays, and both are harmful. The UVB rays are the short-wave rays that cause burning, and UVA rays are the long-wave rays that penetrate deeply into the skin. The next one is geography. If you live closer to equator, like in Australia or certain part of South America, your UV exposure is naturally higher. In fact, Australia has some of the highest rates of skin cancer in the world due to its sunny climate and outdoor lifestyle. The next factor is altitude. Living or spending time at higher altitudes increases your risk because UV radiation is stronger at elevation. The next factor is, unfortunately, outdoor lifestyle. Whether you're a surfer, hiker, or a gardener, spending extended time outside without proper sun protection increases your lifetime risk. Living here in Cape Cod, I see many patients who are sailors with a lifelong sun damage. And that brings me to an important point. UV damage is cumulative. That means every sunburn, every day spent outside without sunscreen, and every visit to a tanning bed, they all add up over time. And now I'd like to take a moment to debunk some of the common misconceptions about skin cancer or skin cancer myths that I hear at our clinic. I have a dark skin, so I don't need sunscreen. This is a dangerous myth. While darker skin does offer more natural protection, as we've discussed, due to high melanin levels, skin cancer still occurs. And in fact, when it does occur in darker skin, it is often misdiagnosed or found later, and it's harder to treat. Skin cancer is only caused by sun exposure, another myth. While UV radiation is the leading cause of skin cancer, you can actually get skin cancer in the areas not exposed to the sun. And again, it's especially true for people with darker skin, but also with people with genetic predisposition. For example, I find many concerning moles on buttocks and other hidden areas when I do full body skin checks at our clinic. Next one. If I don't burn, I'm safe. False. Tanning, whether in the sun or a tanning bed, damages your skin and increases your risk of skin cancer. A tan is actually your skin's way of signaling damage. Here's another one. Tanning beds are safer than the sun. Absolutely not. Tanning beds emit concentrated UV radiation, often much stronger than the sun, and are known carcinogen. So here's another one. I no longer tan or go out in the sun, so I will not get skin cancer. As we mentioned earlier, the sun damage is cumulative. And I see it again in our clinic that some people, for example, who with extensive past sun exposure now do get skin cancers, despite being diligent about sunscreen and sun protection in the present time. Unfortunately, in some cases, the body keeps the score. So how do we prevent skin cancer? Regardless of your skin type, genetic background, or lifestyle, prevention is your best defense against skin cancer. And here's what you can do. Daily sunscreen use. Apply a broad spectrum sunscreen with SPF 30 or higher every day, even on cloudy days or even indoors if you're indoors near windows. Use organic sunscreen if possible or if you have sensitive skin. Sunscreen applied to the face, and it needs to be applied all year round, even in the winter. And in the summer, it needs to be reapplied after 60 to 90 minutes in a direct sun. The next one is protective clothing. Wear hats, sunglasses, and long-sleeved clothing when outdoors. And many brands actually have now those UV-blocking clothes fabrics. Shade is your friend. Seek shade between 10 a.m. and 4 p.m. when sun is at its strongest. Next, avoid tanning beds. There are no safe alternatives to natural sunlight. Please never use them, not before vacation, not before the wedding, never. Stay informed. Understand your risk factors, including skin type and family history, and adjust your habits accordingly. So in conclusion, here's the key takeaway. Skin cancer doesn't discriminate. It affects people of all skin types, colors, and backgrounds. Your genetics and family history play a significant role in determining your risk, but at the same time, lifestyle and sun protection habits are equally important. Prevention is key. Daily sun protection and regular skin exams are simple but very powerful tools in reducing your risk. Thank you so much for taking time to learn about skin cancer risks with me today. Please leave your comments below. If you found this video helpful, please share with the friends and family. And this is a knowledge that can actually save lives. Thank you so much for watching. Until next time. Bye-bye.